Are you tired of those dark, uneven patches on your face that refuse to go away? Do these brown or grayish spots make you feel low about your appearance? Have you tried several creams and treatments but nothing seems to work permanently? Well, this could be melasma, and it's much more common than you think. Melasma is one of the most frequent causes of facial pigmentation, affecting millions of people worldwide, especially women. And while it's harmless, it can deeply affect your confidence and self-esteem. Many people mistake melasma for tanning, sunspots, or regular pigmentation, but it's actually a skin condition linked to deeper hormonal and cellular changes. In today's video, I will explain what melasma is, what causes it, what symptoms to look for, and how it can be treated naturally and holistically. So, make sure to watch this video till the end. Hello everyone, I am Dr. Madhvi Vash from Bharat Homeopathy. I have extensive clinical experience and expertise in treating skin disorders naturally and holistically without the use of steroids or harmful chemicals. Now let's begin by understanding what exactly melasma is. Melasma is a skin pigmentation disorder that causes brown, grayish brown or dark patches on the skin, most commonly on the face. It usually appears on the areas that are frequently exposed to sunlight, such as cheeks, forehead, bridge of the nose, chin, and sometimes the upper lip. These patches develop gradually and often become more prominent with sun exposure or hormonal changes. Melasma is not contagious. It doesn't spread through touch and it doesn't cause itching, pain or irritation. However, it can be emotionally distressing, especially when it appears on visible areas of the face. While melasma is more common in women, especially during their reproductive years, men can also develop it. So now, let's discuss the symptoms of melasma. How do you identify whether the dark spots on your skin are melasma or something else? Let's find out. The most obvious symptom is the appearance of flat brown, grey or tan patches on the skin. These are usually symmetrical, meaning they appear on both sides of the face. Melasma typically appears on the cheeks, forehead, upper lip, chin and nose bridge. In some cases, it can also develop on the neck and forearm if these areas are exposed to sunlight regularly. The third sign is no itching or pain. Unlike other skin conditions, melasma doesn't cause irritation, scaling or pain. You might notice that your dark patches deepen or become more visible after spending time in the sun. This is because UV rays stimulate the pigment producing cells in the skin. So if you are noticing these dark patches and they seem to worsen with sunlight or hormonal fluctuations, it's time to take them seriously. Now let's come to the most important question, what causes melasma? Many people think it's just due to sun exposure or poor skin care, but the truth is melasma has multiple internal and external triggers. Now let's understand them one by one. The first cause is hormonal changes. Hormonal imbalance is one of the primary causes of melasma. During pregnancy, menopause or due to contraceptive pills, there is rise in estrogen and progesterone levels which can overstimulate melanocytes, the pigment producing cells of the skin. This results in excess melanin production causing dark patches. That's why melasma is so common among pregnant women. In fact, up to 50 to 70% of pregnant women experience it. UV rays from the sun are a major trigger for melasma. When your skin is exposed to sunlight, melanin production increases as a protective mechanism. However, in individuals prone to melasma, this process becomes overactive, resulting in uneven pigmentation. Even short-term exposure without sunscreen can worsen the condition. Now the third cause could be genetic. Melasma tends to run in families. If your parents or siblings have had melasma, you are at a high risk of developing it. This shows that there's a genetic component linked to how your skin reacts to sunlight and hormonal changes. Now, certain medications can also cause melasma to develop. Some medicines, especially birth control pills, hormone replacement therapy, and certain anti-seizure medications can trigger or worsen melasma. Additionally, harsh skin care products, chemical peels, or cosmetics that irritate your skin can also make pigmentation worse. Thyroid issue can also trigger melasma. Some studies show that thyroid imbalances can play a role in melasma development. Thyroid dysfunction affects the balance of several hormones in the body, which can in turn stimulate melanin production. Stress doesn't just affect your mind, it also affects your hormones. High stress increases cortisol levels, which can disrupt the hormonal balance and indirectly worsen pigmentation problems like melasma. Now let's discuss the types of melasma. Depending on how deep the pigmentation is, melasma is divided into three main types. The first type is epidermal melasma. The pigmentation occurs in the upper layer of the skin. It appears brown and usually responds well to the treatment. The second type is dermal melasma. The pigmentation is deeper within the skin, appearing grayish or bluish. This type takes longer to heal. Now let's come to the third type. It's mixed melasma, a combination of both where pigmentation appears in multiple layers of the skin. This is the most common type. Now that we understand what causes melasma, let's talk about how it can be treated. See, conventional treatments usually include chemical creams, steroid-based ointments, chemical peels and laser therapies. While these might offer temporary lightening, they often cause side effects like skin thinning, irritation and rebound pigmentation once you stop using them. But don't worry, there is a better, more natural way to heal your skin from within. At Bharat Homeopathy, we believe in treating melasma from its root cause by focusing on your hormonal balance, immune response and liver detoxification, which directly influence your skin's pigmentation process. We have successfully treated thousands of patients suffering from chronic pigmentation disorders like melasma, freckles, post-inflammatory pigmentation, vitiligo, eczema, psoriasis and more, all through personalized non-steroidal treatment. If you or your loved one is struggling with melasma or any other chronic skin problem, remember you are not alone. We are here to help you restore your skin health naturally and confidently. I hope you found this video informative. If you want more such health related videos, then please subscribe to our channel and press the bell icon for regular updates. Thank you so much. Namaste and have a great day.